in listen-only mode.
Hi everyone, I'm Susan Kaufman and you are listening to Attitude Magazine's ADHD Experts Audio. If you're the parent of a child who loves twirling on tire swings or can't stand the tags in their t-shirts or maybe finds the sound at the movie theater intolerably loud, you may be living with sensory processing disorder, otherwise known as SPD. This condition is often confused with ADHD and other symptoms, and it's unfortunately all too little known. Our guest today is Kranowitz. She's the author of two highly regarded books that I can't recommend enough about sensory processing disorder, The Out of Sync Child and The Out of Sync Child Has Fun. Her books have been read by over 1 million people, and as I said, they were very useful to me, and I know they'll be useful to you. Kranowitz will talk about the hallmarks of sensory processing disorder, what it is, why it frequently travels with ADHD, and she'll offer some strategies for identifying SPD in your children, as well as what we call sensory positive strategies for school and play. Carol, thank you so much for being with us today. We're grateful for your time.
Well, it's a wonderful pleasure. Thank you.
Before she speaks, let me just tell you, in case you haven't been here before, how our ADHD Experts audios work. Please post your questions in the box on your screen. Carol will give an introduction to the topic through her slides, and then she'll answer as many questions as we have time for. If you have problems hearing us, please dial in via your phone line. This is an internet-based webinar. After the session, you'll find Carol's slides as well as a replay of the webinar if you want to catch it again or you missed something on attitudemag.com/webinars. And then soon you'll find the audio also in a podcast format on iTunes in the ADHD Experts audio series. So if you need to listen up again, just check it out and in both podcast and webinar replay format. So with that, let me turn it over to Carol with our thanks again for being here.
Yes, I'm happy to be here. So I got my start in SPD land as a preschool teacher, and I was wondering why some of the kids that I was teaching seemed so out of sync. What was so dreadful about a triangle or a tambourine? Why was an obstacle course something that you wanted to stay away from? Why did some children never let their feet leave the ground? Why were some children always fidgeting and restless, and others seemed so inattentive? Was it ADD? And this was many, many years ago. So we thought maybe it was ADD, but no, it wasn't quite right. So I learned about SPD when an occupational therapist came and talked to us at our school, and it made so much sense. SPD overlaps with many other difficulties that children and adults have, and I'm going to give you a whirlwind tour of SPD, and then we'll see how it connects with ADHD. And if I can make this slide go. Well, I can't move it. There. Okay, thank you. We have at least 8 senses. Everyone knows about the 5 senses of seeing, hearing, smelling, tasting, and touching. And you can see the dotted lines here around this little kid that show where the receptors are. So you see the receptors for the smell is in the nose, and the dots around the child's whole body indicate that the tactile system is something that is all over the kid's body. And we all have these senses. The stimuli come from the environment around us. We see something or something touches us, and that information goes to our brain, and our brain tells us how to respond. And that's true for everybody. And I see, oh, thank you, there it is. Okay, could somebody help me with progressing the slides, because I'm not doing it well. Thank you. We also have body-centered senses that nobody else quite shares with us. So our vestibular sense is in, the receptors are in our inner ear, and the vestibular sense tells us where we are in space, how fast we're moving, whether we're up or down or falling or securely in a stance or on a chair, and we need the vestibular sense for everything we do. The vestibular sense is like the master sense. If we don't know where we are, we're going to hang on tight to something that's going to keep us rooted to Mother Earth. So we're going to not want to stand up or swing or go upstairs. We're going to just want to hang tight. Proprioception is the sense of our muscles and joints, and every time we stretch and flex our muscles, we are getting proprioceptive input. And proprioception helps us know how to get into our coat and how to thread a belt through the loops of our pants that we can't see behind us, and how to go up and down stairs and keep our balance. Very important. Interoception is the sense of our internal organs, and that again is very private. Nobody else knows if we're hungry or have to go to the bathroom. And all of these senses, all 8 of these, have to be going smoothly, churning along constantly to help us function smoothly throughout the day. Let's go to the next slide. Thank you. So what functions do our senses serve? Well, if you look at this little list here, you'll see the senses are pretty important. We need our senses primarily for self-protection, to defend ourselves. So if a frisbee is coming through the air and we're playing on the beach and the frisbee's coming at us, we are going to duck, or we're going to get out of the way if we're not good enough to catch that frisbee. We are always using our senses to first protect ourselves to survive. Then when we feel safe, oh, that frisbee did not knock us down or give us a concussion, then we can use our senses for discrimination. And this is learning how to jump for that frisbee the next time and get our vision and our proprioception and our tactile system and our vestibular system all working better so that we can catch that frisbee. But we can't do that unless we feel safe. Safety is really important. We use our senses for satisfaction, for feeling good, so we continue doing what we like and we don't do what we don't like. And we need our senses for action. This is called praxis, which consists of coming up with an idea, that's ideation of something we want to do. Then we do the motor planning, which is figuring out how we're going to get our bodies coordinated so we can return the frisbee. And then the third step in praxis is execution, actually letting go of the frisbee and aiming it toward the person we're playing with. So let's go on. Sensory processing disorder puts all of those everyday functions out of order. What happens with sensory processing disorder is that ordinary sensory experiences, like things that we see, things that we feel, movements that we make, come in through our sensory receptors to our brain, and our brain reacts in an atypical way to that sensation. That could be late, our reaction could be late, or it could, the connections might go in the wrong direction. Anyway, the information comes in and our brain mishandles it, and therefore our responses are affected. So we don't respond as we should typically. And it affects everything we do because we need good sensory processing for everything we do. So we can't look in the brain, but we can look at kids' behavior. Behavior means something. Let's go on. Patricia Lemmer is a friend of mine, and she came up with this list, and other people concur with it. So often we look at sensory responses that children have, and we have to wonder, is it a sensory processing problem or is it something else? And particularly today, I want you to think about inattention and hyperactivity and impulsivity. These are symptoms, of course, that are ADHD symptoms. So, you know the old saw, when you hear hoofbeats, look for a horse, not a zebra. So ADHD has been around a long time, and we might look at inattention and hyperactivity and we might think, aha, ADHD. Well, the symptoms fit that diagnosis, but let's look at the other possibilities. Let's look at these zebras. And SPD is a biggie. Why are children inattentive? Well, it could be ADHD, sure, but it might be SPD because if the tag in your shirt is irritating the back of your neck and you have tactile dysfunction, you're not going to pay attention to what the teachers say. If the chair that you're sitting on has 4 legs and only 3 of them hit the floor simultaneously, you are not safe. You are going to be catapulted off the surface of the earth if you have a vestibular problem, and so of course you're not going to listen to the teacher. You could have auditory issues. Many children are very over responsive to children around them who are writing with pencils and erasing or scraping their chairs around, or the windows flapping, or the fluorescent lights that are not only driving them crazy with the visual flickering that many people don't see, but also driving these children crazy with the sound, because some children are such sensitive hearing and seeing that they see a flicker and hear a sound that the rest of us don't, and that will cause inattention. Hyperactivity and impulsivity, again, these can be symptoms of SPD. The child could be wriggling and squirming in his seat because the teacher has not had a chance to free the kids up and let them stand up and stretch. Or recess. I think we're getting recess back, I hope, in school, but unless we have a strong national policy about recess every day for children, I recommend an hour a day for children through the school day. 20 minutes here, 20 minutes there. Unless we have movement, sitting still is not good for anybody, especially kids with SPD. They need to move because moving is learning. And you can see the other items on this list of the alternative diagnoses. I like the last one very much. Sometimes inattention and hyperactivity are simply symptoms of being under the age of 7. Let's go on. Okay, so there are 3 major categories of sensory processing disorder. One is sensory modulation disorder. Sensory modulation disorder has 3 subtypes. One is sensory overresponsivity, and this is the child who's the avoider, the one, everything is too much for this kid. He's going to live under the desk at school. His hands will be over his ears. He's going to shield his eyes. He doesn't want to be touched. Everything is too much for this child. And this is a very emotional kid. Let's go on. Sensory modulation disorder has a second subtype, sensory under-responsivity. And this is the child who doesn't notice what's going on around her. If you are kind of in the child's face, or I don't mean in a bad way, but I mean if you get right in front of the child, speak clearly, and say, now it's time for math, or now we are leaving for the playground in 5 minutes, put the Legos away. If you're right there, you can get this child's attention, and then the child will probably have a fine time going to the playground and doing outings with the family and learning at school. Once this child gets started, things tend to go pretty well, as I understand it. But to get their attention is the job of the child's grown-ups, because the child might not notice what's going on. The next slide, please. Sensory modulation disorder has a third category, and this is sensory craving. Sensory craving This child doesn't object to sensations, and this child notices sensations. This child has to have them. So this is the bumper and crasher. This is the kid who gets on the tire swing and is there for half an hour. Or this is the climber. Everything is a ladder for this child. The bookcase is a ladder. The kid's never filled up. He always wants more movement, more popcorn in his mouth, more noise. And this kid will be kind of a daredevil going after seeking sensations constantly. Let's go on. So the next category in sensory processing disorder is sensory discrimination difficulties, and this is the sensory jumbler. This is the child who might not have a modulation problem, or he might have a modulation problem. There are all kinds of matching up that can happen in SPD. This jumbler, this is the kid who goes to pick up a bucket, and he might have picked up this bucket of water every day. Maybe his job is to clean, well, this is an old-fashioned job, to clean the blackboard. I bet we don't have blackboards at school so much. But anyway, let's say his job is to pick up a bucket every day, and every day it's the first time he's ever done it. He doesn't discriminate. He doesn't use his eyes to make a judgment. He doesn't use his proprioception to be able to evaluate how that bucket is going to weigh. So he picks it up with too much force and the water goes everywhere. Tomorrow he might pick it up with insufficient force and not be able to get a grip on it as he comes up empty. The person with discrimination problems will be putting his buttons in the wrong buttonholes. Speaking, listening might be hard. He might have auditory discrimination issues where the beginnings and the endings of words are muddied, so he might not hear the consonants. Someone might be talking about the bud on the tree, and he might think the person's talking about the bug on the tree. So you'll see kids in conversation, and they think they're engaged in a conversation with their peers, and the other children are looking at this child like, what? Where is he coming from? What the heck is he talking about? Because he's missing out on things like consonant sounds. He might miss visual discrimination cues too. So B and D gets mixed up not only in the ear but also on the page. It's very embarrassing to have sensory discrimination problems because you're making errors, and these kids tend to get laughed at. And you grow up with this kind of thing. You grow up with modulation problems too. Let's go on. A third category of sensory processing disorder is sensory-based motor disorder, and this has two subtypes. One is postural disorder, and this is the sensory slumper. This is the kid who moves in a clumsy, disorganized way. This child might have difficulty stabilizing himself, so you're not going to see him clambering up the slide and then getting into position to come down and coming down gracefully and jumping with both feet and running around and doing it again. No. This is going to be a child who avoids that kind of playground activity because it's daunting, or does it in a kind of clumsy, childish way. Some of the problems involved with postural disorder are with bilateral coordination. Many kids did not crawl as little children. They have difficulty crossing the midline, which means using the eye, hand, or foot of one side of the body in the space of the other eye, hand, or foot. So what we want to do with these kids is get them in motor activities that integrate the two sides of their body. Bilateral integration happens with crawling, running, walking, climbing stairs, left, right, left, right, left, right, swinging. That kind of thing will help with a child with faulty bilateral coordination. Let's go on. The second subtype of sensory-based motor disorder is dyspraxia, and this is pretty big. I call this child the sensory fumbler. Praxis, I was saying before, a function of SPD. Praxis is ideation, motor planning, and execution. In the child with dyspraxia, that is not a smooth progression. Ideation is coming up with an idea of something you want to do, and research is showing that children with SPD are less nimble with coming up with an idea. So you hand the child a paper towel roll or a string or a box, and you say, show me something you can do with this. Typical children will say, oh, I can step into this box, I can hide in this box, I can push this box, I can look through the cardboard tube, I can wrap the string around my finger. They'll come up with a lot of ideas, and children with SPD will not do that. Here's a good chance to tell you that children with ADHD will come up with the ideas and the motor. They'll probably have good motor planning, and they will be able to execute their ideas. It's SPD is the category of difficulties where praxis is especially involved. Kids with dyspraxia prefer the familiar rather than the novel, and that's a big difference also between the child with SPD and one with ADHD. The novelty is what our kids with ADHD are after. They love everything that's new, and they are great explorers, and kids with SPD like the old tricycle, the little tricycle that they know how to get on. The new, big, shiny tricycle, they don't have any interest in it because it's just too difficult to figure out how to do the motor planning to get onto it. Kids with SPD tend to like the same easy puzzles and the same bedtime story, and they just really like what they know. Let's go on. And the next slide. And let's see, I can probably... Okay, so wearing sensory goggles. This is a term two SPD moms came up with. Lori Renke and Carrie Fannin are their names. I love it. They say, put on your sensory goggles and look at children through these goggles and ask yourself a couple of questions. Is my child avoiding ordinary touch and movement? Those are the biggies of SPD, touch and movement, and other sensations also. Is my child seeking more touch and movement and other sensations than typical children do? Is my child having difficulty functioning on the playground and at the desk and at the dinner table and at the grocery store? And those, if you say, oh, wait a minute, yes, my child is having problems with these issues, with these particular things, think zebra, think SPD. Another thing to do while you're wearing your goggles is ask yourself, what is the child's self-therapy? Kids with SPD and probably with all kinds of neurological issues will find out what works for them. So a child who is a sensory seeker, for instance, will be looking for the swings that he can go the highest on, or the tire swing that he can spin on, or the trampoline that he can bounce on. He's looking for more all the time. An over-responsive child who wants less, her self-therapy might be to crawl in under her comforter and cozy up in her own bed where it's safe and she can be contained and quiet. So look at the child's behavior. Ask yourself, is this child doing something a lot that other kids don't do so much? And look at it to see if it's a sensory issue. And then looking at the child's behavior for what helps the child, stretch it if you can and see if you can find a way to use what the child already uses to calm him or give him a jump start. Yes, next. This slide comes from Lucy Jane Miller and Royanne Ahn, who are, Lucy Jane Miller is the occupational therapist who is the premier researcher of this topic, and Royanne is a psychologist also specializing in SPD. They're at the STAR Center in Denver, and they were looking at all these kids, 2,400 children, 181 of whom are represented in this Venn diagram. So 32% of 181 children had ADHD only. 28% had SPD only, and 40% of them had both. And the overlap is something that we are concerned about being able to see, because what we do with these kids is different depending on what the disorder is. So we do not want to give Ritalin, for instance, to a child with SPD because Ritalin, I understand, makes everybody pay more attention. And so you'll see that kids with SPD might be paying more attention, but it does not do anything to affect the underlying issues, which are over-responsivity or under-responsivity or discrimination problems. But I thought that our listeners might be interested to see how this overlap goes, because we often have the two happening simultaneously in a child. Let's go on. So Lucy Jane Miller in Denver started a very interesting research study years ago called the Sensory Challenge Protocol. And this is a good, I want to tell you about this because it shows how the differences between kids with SPD and ADHD. Okay, the child comes into a room and it's set up like they're inside a rocket going into outer space. It's just a room, and it has a console made out of a cardboard box in front of it. And the child sits in a chair, and this chair is going to tip backwards about 30 degrees very slowly and quietly. But first, the child is told that she will smell something, hear something, see something, and feel something, and then she'll be ready to go up in space. And the child is agreeing to this. It's rather a pleasant environment. A pad with wires attached to it is placed on her palm, and another pad with wires is placed on her tummy above her navel. And these pads are going to register the child's electrodermal response to sensations. Now, we all respond constantly to sensations all around us. So if we hear the door slam, we all respond a little bit, and most of us say, oh, the door slammed, that's all that was, and then we calm down. We notice it, it does not alarm us, and we could protect ourselves if we have to, but we don't have to, so we calm down. Now, at the moment that we are alerted, everybody exudes a little bit of sweat. It's called eccrine sweat. It's not like exertion sweat, it's emotional sweat. And these little pads on the child's hand and tummy are going to register this electrodermal response. Okay, so the child, so the therapist, there with the child takes a small vial of pleasant wintergreen oil, and not touching the child, she just whisks it under the child's nose. And if the child is over-responsive to smell or olfactory sensations, the kid's going to rub her nose or turn her head or look disgusted or try to get away in some way. And some children with SPD will do that. Or they might really like it and want to grab it and get more of it. The auditory stimulus is a noxious kind of siren that most of us don't like. The visual sensation is a strobe light. Then there's a feather that gets traced along the child's jawline, and finally the chair is tilted backwards. So what we find, I'm sorry, I should not say we. I only report about it. I don't do this fabulous research. What the researchers find is that children with sensory issues will be trying to avoid these sensations and be quite uncomfortable, or they might be very interested and like them and be happy to have more, or they might not notice them. The children with ADHD do just fine. They do just as well as typical children do. They alert to the sensation and get over it. So every sensation comes 10 times, and by the third time that siren sounds, kids with ADHD respond the way typical children do with, oh, whatever, while the children with SPD are alert, 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 or else nothing. Let's go on. Another research study that differentiates children with SPD from those with ADHD is this little pilot study, 68 kids altogether, so it wasn't a large study. And the kids individually were seated at a table, and there was an apparatus in front of them on which they would see a square, and then they would see a circle. So their job was to, when they saw the circle, they were to press the button on the right, and when they saw the square, to press the button on the left. Okay, so they did that. Everybody is smart enough to do that, and you know, no stress over that one. Then they were told to stop pressing the correct key if they saw the shape and heard a tone. Kids with SPD refrained from pressing the key, but guess what? The kids with ADHD had to press the key. So the hypothesis is that there's this double dissociation. If you have ADHD, you have good sensory habituation. Habituation is what the sensory challenge protocol is all about. How do we habituate to the sound of that door slamming or that siren sound? ADHD kids have good sensory habituation, but they cannot inhibit their desire to press that key. And kids with SPD had poor sensory habituation, but they understood the directions and obeyed the directions and did not press the key if there was a tone. So let's go on. And this is a chart that talks more about that dissociation. Let's go on. So what can we do? We can get our kids playing vigorously with open-ended fun and outside, outside, outside. Dr. Ayers, Dr. Jean Ayers, was the occupational therapist who formulated the theory of sensory integration or sensory processing, which he also called it. and back in the 50s and the 60s, and she said fun is a child's word for sensory integration. If the child is really engaged and loving what he's doing, chances are he is developing and enhancing his sensory processing. And where does this happen? It's outside. It's where the action is. It's not in front of the computer or with a handheld apparatus. We need children to be using as many of their senses as they can simultaneously. The more important it is, the more senses we use. And ask yourself, what a memorable childhood experience was, and I'm 100% sure that you're going to come up with something, some activity of childhood that was outside, that was playing with other kids that you felt safe with, or grown-ups that you loved being with. You were helping to further the activity. You had good ideas that were acknowledged and honored. You were communicating with other people. You were using tools. You were moving, and probably there were 5 or 6 sensations being used at the same time. I ask this question to every audience where I do a presentation, and I never get anybody saying, my memory is watching television. So I worry about our kids today, because if they're not outside digging ditches and making fords in the creek and climbing trees, they're missing all these wonderful opportunities to use their whole body and weave all the senses together, integrate them, and learn. We need to also get our hands on our kids, and sometimes when children are having a meltdown, you don't know what to do, but I suggest going toward your child when really you'd rather just slam the door and leave, but go toward your child because your child is out of control and needs a grown-up. So embracing your child with a strong hug, suggesting that the child lie down on the couch and taking couch cushions and pressing on the child's back and buttocks and legs is very soothing and very calming, and it's kind of funny too. Teach the child how to squeeze his own body, squeeze his forearms, his biceps, his shoulders, and squeeze his thighs and his calves, and doing squats is really great to get deep pressure into the body, which is calming. Heavy work activities. Make these 4 verbs be your mantra. Push, pull, lift, and carry. And while you're at it, chew, toot, and blow. And get your kids moving. Let's have the next slide. Oh, this does not show up well. I'm sorry, maybe when it's printed out it will. These are research studies, recent research studies. If you go to spdfoundation.net and go to research, you will see these studies. These are the ones that here all have to do with ADHD. I want to call your attention to just a couple. One is that 80% of children with SPD and specifically sensory over-responsivity do not fit the DSM criteria for ADHD. In a cohort of children studied for a long time in a New Haven, Connecticut study, 80% of the kids in this huge cohort do not meet DSM criteria for ADHD. I think that's really important. That one is by Dr. Ben Sasson. And there are several studies that are showing that children with SPD, specifically with over-responsivity, have different brain responses to sensory stimuli from the responses other children have. So it's exciting that this brain research is going on, and we're seeing that the children with SPD respond in parts of their brain that kids with ADHD, their brains are not lighting up in the same places. The scientific work group is doing a lot of this research at Sensory Processing Disorder Foundation. A couple of other things to tell you. One is there's a wonderful book for you to look into. It's called 9 Conditions Commonly Diagnosed Alongside ADHD. And you can find that at the Attitude website. I hope that you'll be interested in learning more about SPD and my books. You can go to my website, outofsyncchild.com. And I have written an article that's on my website on this topic of the two lookalikes, SPD and ADD. And I have talked and talked and talked, and now I'm ready to listen.
Thank you so much, Carol. That was
You're
a great
welcome.
introduction. We have lots of wonderful questions. Let me just start with asking you to describe the treatment for SPD. Some of the people who are participating have children who are receiving OT services. Others are asking if their child should receive services. Can you describe what OT services are and how they treat SPD?
Yes. Occupational therapy is the field, and within that field there are occupational therapists who have been trained in sensory integration theory and techniques. And so what they provide, the therapy they provide, is called OTSI, occupational therapy using sensory integration techniques. Occupational therapists work with the child to find out what the child really likes to do, and then follows the child's inner drive to do those activities, the goal being to get the brain-body connection working more smoothly. And what OTSI does is it actually creates new neuronal connections that are permanent. So the child goes in to see the OT and doesn't want to touch anything, but the OT brings out this very alluring shaving cream with plastic teddy bears inside it and coins and penny and doodads, and the child is so interested that he'll touch the shaving cream and get into it to get the prize. I mean, that's one simple example. There's always activity. The child is not doing a lot of sitting. The child is doing a great deal of moving, because that's how the brain and the body get integrated and everything happens. I suggest that if parents are wondering if I've piqued them and they think that maybe they do have a child with sensory issues, go for an evaluation with a therapist, or sometimes just a conversation without the sometimes you don't need the whole assessment. Sometimes you can just try a little OT and find out. You will see that almost every child loves OT using sensory integration techniques. So go do that. And if you need to know where to go to spdfoundation.net. And they have a registry there where people all over the country have registered. These are folks who are practicing OTSI.
Okay. Just to frame SPD, is it a DSM diagnosis, and who diagnoses it? Is it recognized, or are we still in the infancy of understanding and recognizing SPD?
Yeah, I don't think we're in the infancy. I think we're in the teenage.
Okay.
It has taken a long time for professionals outside the field of OT to learn about SPD, and more people are doing that. The DSM-5 refers to over-responsivity, but it does not give SPD its own category, and that's okay, because DSM, in my mind, DSM is about mental disorders, and we can think about SPD as it's not like obsessive compulsive behavior. It's a physiologic problem. It's a medical problem, but there's no medicine for it. So we just need people to be more aware of it. And many physical therapists, speech and language therapists, developmental optometrists and other enlightened specialists are weaving more and more sensory techniques into their practice with great benefit.
But I think that's an important point you made. It's not really a mental health diagnosis. It's a diagnosis of the sensory system.
Yeah.
It's very different. Interesting. Some questions from folks about, in some cases their children were receiving OT services but are no longer. How long does one continue to treat SPD? And this goes back to a question I asked you before we started the webinar. Does it persist into the teens and adult years? There are a number of people who are very interested in the adult, the carryover of a childhood SPD diagnosis.
Right. Well, it's evident that children who are diagnosed early and treated with early intervention have a great benefit because they're the neuroplasticity is such that you can do therapy with wee babies and get their brains to make these connections that they will need. So the younger the better. However, this is not to dissuade parents of teenagers or adults themselves with sensory issues from seeking OTSI, because at any age we can be helped. But learning to, old dogs take longer to learn new tricks. So the process is myelination. The brain becomes set in its way, but therapy can bend it and make it much more possible for adults to function happily too. And I'm just working on a book right now, The Out of Sync Child Grows Up, and I'm hearing from many adults who are getting therapy in their late teens and early adulthood who are thrilled with the progress. And it becomes a psychological thing, and anxiety is part of it as you grow too. So there are lots of layers to the onion by the time you're 19 years old. But therapy can definitely help.
Well, that's reassuring. I mean, there's one person on the webinar whose husband she's pretty sure both her child and her husband have the same sort of aversion to being touched, and she's wondering about what that means for adult relationships.
Yes, because when the adult jerks away or reacts with an elbow in the ribs if someone gently caresses his head or something. Of course, the person who's initiating this gentle, loving touch is going to feel rejected, and this is true. This SPD can wreck intimate relationships. And you think of the person all his life. As an infant, probably his mother felt rejected too, because these are babies who didn't want to nurse. They were not comforted as most babies are by skin on skin and cuddling. So if you can help the teenager and the adults understand that it's not their fault that they're responding this way, because it's their tactile system that's responding that way, and they love you, and there is something that can be done about it. Think how that can loosen up the tension that's been there for years.
Absolutely.
Yeah, I hope you'll take care of that.
Okay. Let's see. Interesting. So many interesting questions. This person says, my kids suffer because I hate hugging, touching them. Thank you for your great work. I wouldn't have figured out why I was like this. That's interesting.
Thank you.
Another person, another fan here says, a mother to an 8-year-old child with SPD and ADHD, your book literally changed my life. So there you have a thank you from Ian.
Thank you.
There's some questions about where SPD comes from. Do we know anything about what causes it?
Well, it looks like it's either genetic and runs in the family, and sometimes the child comes out looking as unhappy with Play-Doh and finger paint as mom is. Sometimes, and I remember this as a teacher, sometimes it was a tactile issue in mother or father and child, but the opposite. So I remember one little girl specifically who was not satisfied just with finger painting on the waxy paper. She wanted to finger paint the table, her own body, and her neighbors. And so there was paint everywhere, all over the other children and the table, everything. She loved that. She was a sensory craver. Her mother had a tactile problem. She was a tactile over-responder. So her mother hated all this mess. And it was a huge, exciting, almost teary epiphany for this mom in a conference that we had where we teachers were explaining to the mom, well, you know, you have the same thing, it's just two ends of the spectrum.
Right.
And what a relief to understand it. And I don't know if that answers
No, that's helpful.
Okay.
And that leads me to another question. I assume from what you're saying and others say that a person can have coexisting oversensitivity and undersensitivity.
Yes.
It seems that that's the case, right? Depending.
Yes,
Okay.
And thank you for bringing that up. That's right. And a classic combination is tactile over-responsivity, no Play-Doh, no mud, no bread dough for me, but give me plenty of movement and activity and let me get to the playground. So it's craving one kind of thing and avoiding another kind of thing.
You just described my daughter perfectly, so I know what you're talking about. There are some questions from people relating to school. What kinds of words do they use to get their school system to consider making changes in the classroom? What kind of changes in the classroom can help? There's a couple of teachers who are asking what they can do in the classroom to help kids with SVD. And are there IEP or accommodations that parents should request to help their children with I know that's a big question. With
yeah,
SVD.
And I'm not expert at IEPs, but I would say first thing is address the other person, the parent or the teacher, with a smiling face. And say, hi, I bet it's tough for you at school or at home. You don't have to start out quite that way, but your point is I noticed your child. I notice this child has hesitancy or gets kind of confused with this kind of activity at school. And I have noticed that if I give this child a great big bear hug and let him go to the bean table, and I'm talking about little kids here, you know, or let him change the guinea pig cage and hold the guinea pig for 10 minutes, I find that that's a wonderful way to settle him down, give him some tactile input that's good for him. And maybe you can do that at home. Or the parent can say to the teacher, we notice that if we let the child jump on the mini trampoline for a few minutes or get on a little teeter-totter and balance left and right for a few minutes before getting on the school bus, or if we let him walk to school instead of taking the school bus, we find that that kind of activity will help him settle down. So saying to the other person, I feel your pain. I know what my child must be like for you in a different situation. And here are some techniques that I have that work for me. Let's hear yours. That can start a wonderful collaboration and conversation and reduce the kind of conflict that parents and teachers often have.
Okay.
And if I can toot my own horn, I do have lots of ideas for parents and teachers in my books. And
absolutely.
Growing an In-Sync Child that I co-authored with Joy Newman, a perceptual motor therapist. It also has tons of ideas. Growing an In-Sync Child. So
okay. Yeah. I mean, I remember from my daughter's childhood, large motor activities,
yes.
A lot of running and sensory activities in the classroom were really helpful also.
Yes, every 10 minutes we should be up and moving.
Every 10 minutes, wow.
Yes.
We should all do that.
Yes.
I think we've touched on this, but there's still a lot of questions about people wondering whether SPD is outgrown. Is it worth getting treatment as a teenager or an adult? Again, is this a lifelong disorder? And I think you touched on that by saying early treatment could help it. But if it's not treated, is it something that just survives age regardless of?
Yes, that's my understanding. That people don't grow out of it; they grow into it.
Okay.
So they learn, well, they're just going to join the chess club and play with one person at a time, not the football team.
Mm-hmm.
They will self-select activities and friends that make them comfortable and satisfied and help them learn, and avoid what is the opposite. SPD will change as people grow. Some things do, some problems dissipate.
Mm-hmm.
But my understanding is that if you hate those seams in your socks and labels in your t-shirts when you're 3 years old, you're going to hate them when you're 33 also. So there are things that you can do, and adults do them. They find out,
right.
But I do implore everybody to look into it, read about it a lot, try some therapy, because it can turn things
Make a
around.
difference.
Yes.
So the last question from the parents for kids who have both ADHD and SPD, how do they go about that? If medication is not from ADHD is contraindicated for SPD, what is their strategy? What should their strategy be?
Yeah.
One person says, should we first try OT and then see if that helps impulsivity? And if not, try medication? And how should they approach that?
I always think OT is the first place to go. I always think trying something natural and physical is better than medicine. I understand medicine is something that some people have to have.
Right.
But if you have a choice, start with the OT, because it helps everybody, including the child with ADHD.
Totally.
And it has lasting benefits. And Susan, I just want to tell you something that's funny. An OT friend of mine said, telling the difference between a kid with ADHD and SPD is easy. And I said, what's the answer? What's the answer? She said, well, you take them out to the playground and you say, run around the circumference of the playground 3 times. And the kid with SPD will feel so much better and will sit down and will be attentive and will not be overactive and will get the task done. But the child with ADHD will still be fidgety.
Oh, that's so interesting. Yeah, so the sensory diet will do it for the kid with SPD, but not for the kid with ADHD. Yeah, that makes so much sense.
Yeah, a kid with ADHD will feel good after that run, because that makes them feel good, but
they'll still be fidgety.
Yeah,
interesting.
Yeah.
So let's see. Claudia says, many of the sensory diet activities I've implemented at home have come directly from your books. It has truly been a godsend. Thank you. So listeners, look for the Out of Sync Child. And Deirdre says, I'm 53 and I still cut the tags out of my clothes. There's a person who is reporting on that aspect of it. I want someone who's 70. I still find the label of my clothes too itchy. So I'll be looking you up online, she says. So Carol, thank you so much for this time and for everything you've done to make SPD widely known. It's been hugely helpful, I think, to many people who just didn't know what this was about. It's just, so misunderstood. So appreciate it very much.
I appreciate the chance.
And to everyone listening in, next week, July 8th, we have a really important webinar with Naomi Steiner, who's the leading researcher on neurofeedback techniques and cognitive training. Many people who are looking for a natural treatment would like to know about the various kinds of cognitive training and neurofeedback and whether or not they really work. And Naomi Steiner is actually going to tell us about the most recent research on the topic, which I think is ever changing.
Oh, sounds very interesting.
Yeah, she's a really big star. So thank you so much, Carol. Thank you, everyone. Have a great 4th of July weekend. Go to attitudemag.com/webinars if you want to listen to this again or download Carol's slides, which I think are super helpful. Thanks, everyone, and have a great weekend.
Bye-bye.
Bye.